members here and our witness to the Subcommittee on Oversight and Investigation, and I will start with my opening statement. We convened this hearing of the Subcommittee on Oversight and Investigation Day to gather information concerning the Patient Protection and Affordable Care Act high-risk pool regime. The administration's health care allocated $5 billion to provide health care coverage for individuals who have been locked out of insurance market. The President and the Democrats tried to sell this law to the American people by telling us how many people were unable to get health insurance and how this law was going to protect these individuals, while somehow saving the American taxpayers money. It's been 1 year since the health care law was forced on the American people. It's been 9 months since the high-risk pools became operational. The chief actuary of Medicare and Medicaid estimated that 375,000 people would enroll in these high-risk pools by the end of 2010, but only 12,000 actually did enroll. CMS informed us that they've conducted a massive outreach campaign to try to advertise this program in order to get people to sign up. Who is paying for this advertising tour is a good question. The taxpayers. Through the $5 billion allotted to this program in the health care reform law, this means money that was allocated to help the uninsured is being used to help the administration save face and rescue this program. This is on top of the previous Democrat majority spending an entire year talking about nothing but this health care law. If countless speeches by the President can't advertise these pools, these high-risk pools, how can a bureaucratic advertising campaign hope to accomplish the same goal? Just as alarming as the low enrollment numbers, this committee has learned through its investigation that low enrollment does not equal low costs. For example, California expects to accumulate $1 billion in claims over the lifetime of this program, with approximately 70% of the tab paid for by the federal government. This means that California alone, one state that is, expects claims to eat up almost 1/5 of the total cost of the program. Our investigation revealed that not a single state expects premium revenue to be near the cost of claims over the life of this program. Now, back in December, the Washington Post reported that, quote, New Hampshire's plan has only about 80 members, but they have actually spent nearly double the $650,000 that the state was allocated for this program. HHS agreed to give New Hampshire more money, end quote. So this is a program that must operate within a fixed budget of $5 billion. HHS has not explained how it intends to keep the program running through 2014 without additional funding. Our investigation has also uncovered problems with the implementation of the high-risk pool. In order to get the program up so quickly, HHS used the CHIP formula to allocate money between the states. While the CHIP formula is used to determine the number of uninsured children in each state, we would think the HHS would use a formula that measures the number of uninsured children with pre-existing conditions in each state, since this fund is supposed to help the uninsured with the pre-existing condition. This program uses a non-relevant formula simply because it was easy and already available. This inequity could mean people in some states are getting more than they need, while people in others aren't getting enough. We want to make sure that the money is being allocated fairly and properly. Obamacare is supposed to be the solution to our nation's health care ills, but here we are, 1 year later, and has a single promise made by the President and the health care plan that the Democrats passed, promise they've made about this law come true. The high-risk pool program is yet another promise that has fallen short, in our opinion. We were supposed to enroll over 250,000 Americans. We didn't even reach 5% of that goal. Steve Larson, the Deputy Administrator and Director of the Center for Consumer Information and Insurance Oversight, was before the subcommittee back in February to talk about the waivers. We remember that. that HHS has been granting to states and entities that can't afford the administration's health care plan. Since he testified just 2 months ago, we've seen more states, struggling companies all seek waivers. A big indicator to me that we are on the wrong track is the number of people in need of waivers to relieve them of the legislative and financial burdens of the Democrat health care plan. As we've seen through our investigations, this is a problem that is getting worse. We intend to hold HHS accountable today for what we see as low enrollment, skyrocketing costs, and poor implementation of a program that was promised to help support one of our most vulnerable populations. So I welcome Mr. Larson returning, and recognizing the ranking member, my colleague, Ms. DeGette from Colorado.
Thank you so much, Mr. Chairman. Before I give my opening statement, I'd like to take a moment of personal privilege and introduce my sister Kathy and her family, who have come here to visit and see how sausage is made all week long.
Kathy, you're welcome.
Mr. Chairman, President Obama signed the historic health care reform legislation into law just 1 year ago. When the law's full benefits have been implemented, every American will have access to affordable health insurance, and abusive insurance industry practices like discrimination against people with pre-existing conditions will be banned entirely. Millions of Americans are already benefiting from the law, including Americans with pre-existing conditions. Thousands of these individuals, thanks to the subject of this hearing, the Pre-Existing Condition Insurance Pools, or PCIPs, have access to affordable individual coverage for the first time. Prior to the passage of the Affordable Care Act, health insurance for people with illnesses like diabetes, asthma, cancer, arthritis, or HIV/AIDS was either not available on the individual market or was so expensive as to make it effectively unavailable. But the Affordable Care Act immediately banned the egregious practice of denying coverage to children with pre-existing conditions. And the Affordable Care Act also offered immediate benefits to adults with pre-existing conditions through the PCIP program. These plans also offer individuals with pre-existing conditions insurance at the standard individual market rate, not the exorbitant rates offered on the private market. These plans began accepting applications in late 2010, and over 12,000 people are now enrolled in them. One of the enrollees is John Barthel, who's a constituent of mine from Colorado. Mr. Barthel, a bartender who works on his feet all day long, suffered from a condition I'm well aware of, severe arthritis in both hips, and desperately needed 2 hip replacements to keep his job. But his employer doesn't offer health insurance, and he could not obtain health insurance on the individual market. When he learned about PCIP, he signed up immediately. He's since had 2 hip replacements, and in his words to my staff, he got a new lease on life. He says that, and I quote, "The health insurance coverage provided for me under the Affordable Care Act took me from chronic pain to free daily life and restored my ability to support myself." And Mr. Chairman, I wanted to have Mr. Barthel come here in person at this hearing, but we were told that he would not be allowed to testify. So I'm disappointed by this decision, but I'd at least ask unanimous consent that his letter to the committee be included in the record.
By unanimous consent, so ordered.
Thank you.
Right to object.
And
I do so to inquire why he was not allowed to come. Here is a man who could tell us from his own experience what these high-risk pools meant to him. Why wouldn't we allow him to come, Mr. Chairman?
Well, Mr. Waxman, you understand that we're going to have continued hearings on this, and we'll have another opportunity to bring your witness in. I thought as we started this process, dealing this with one specific subject, we'd have just the government explain exactly what the status is, and so that's why we had just one witness. I think
how many hearings do you intend to call on this subject?
Well, I'll be glad to sit down with you at a later date. We are just in the early stages of this. As you know, we've got plenty of hearings on the health care plan, and this is just one of many. So at this point, by unanimous consent, so ordered, the letter will be entered into the record.
Chairman, not to put too fine a point on it, this is the second hearing the minority was denied their witness, so I hope we can work this out for future hearings. I know that we're going to hear, in fact, we already heard from the chairman, that PSIP enrollment is lower than anticipated. And I appreciate that CCIO, in recognition of these concerns, has improved its outreach efforts. I hope we'll hear more about those efforts from our witness, but I find it a little ironic that my friends across the aisle would complain about low enrollment in a plan that every single one of them voted to repeal. Because when I hear about stories like John Barthel, I find repeal efforts impossible to understand. These thousands of people who now have access to insurance for the first time would have it whisked away immediately. So it seems to me that the solution to the problem is to try to increase outreach efforts so that we can get a lot of people who are uninsurable because of pre-existing conditions to be enrolled in insurance. Now, PSIP is not a permanent solution to the problems faced by people with pre-existing conditions, that's for sure. It's a transitional benefit that will be superseded by the full panoply of the Affordable Care Act reforms in 2014. But what the program is right now is critically important to that slice of people who are and will be enrolled. That's why we should not repeal this law. Doing so would rob thousands of PSIP enrollees of the health care coverage they now have and take it away. A more productive discussion would be a discussion about how we can enroll more people with pre-existing conditions in this program until we transition to full coverage in 2014. Thank you.
The gentlelady yields back. I'm going to yield myself 2 minutes, and then we'll hear from other members on the majority side. This hearing once again represents what the legitimate oversight of ongoing federal activities over this health care law, what we should be doing in this committee. And I would just address to the ranking member, we are doing it this year as opposed to last year when we had not a single oversight hearing on the implementation of the health care law. Now, those with pre-existing conditions was identified as one of the major reasons that the health care law was necessary. But I guess I would just simply ask the question, I don't really recall the provision in H.R. 3200 that we marked up in this committee on pre-existing conditions, but was it really necessary to spend $1 trillion to fix this problem, which after all is what we've done with the Patient Protection Affordable Care Act? And we all want to help, but was it necessary to go to the lengths that we did and essentially upset the system that was working arguably for 2/3 of the population in implementing this program? And we've heard that the universe of people with a medical diagnosis who were locked out of the system was vast. We were led to believe it was in the millions. At different times, 8 million, 12 million were used by the President in his addresses during the summer of 2009. But at the end of the first year, 2010, we had 8,000 people, and then with a massive advertising campaign, we signed up 12,000 people. Well, why is that? Is it because the premiums were too high? Is it because we mandated that you had to go uninsured for 6 months to qualify? That's kind of risky. Is it because people don't know we've spent a lot of money in advertising? Or was it because the problem just wasn't as bad as we thought? Despite the low enrollment, the program's finances are high. It begs the question, was this a proper path to take, or could we have provided subsidized risk pools? Now, last Congress, the ranking member of the Health Subcommittee, Nathan Deal, and I introduced H.R. 4019 and 4020, which actually attempted to get this population as locked out of the current system while providing the right incentives for those who have lost their jobs. At this point, let me yield 1 minute to the gentleman from Nebraska, Mr. Terry.
Well, thank you, Mr. Chairman, or Acting Chairman. I appreciate the opportunity to hear from this agency how we can remove waste and perhaps even abuse of funds under their control. So it concerns me that my friends on the other side of the aisle do not wish us to press to find wasteful use of taxpayer dollars or abuse. Hopefully we can get an explanation on the early retirement insurance program, where there has been in the last day or two several news articles that concern me about waste and possible abuse of $5 billion that seem to be going sent to companies that are quite healthy and wouldn't need government subsidies for early retirees. For example, the United Auto Workers received the most this last year at $206 million. A healthy company, AT&T, received $140 billion. Verizon received $91 billion. General Electric, I guess if you hug the president enough, you'll get $36 billion. General Motors received an additional $19 billion. I'd like an explanation of why these companies were even eligible for government subsidies for an early retirement program. Yield back.
The gentleman's time has expired. To yield the balance of our time to the gentlelady from Tennessee, Ms. Blackburn.
Thank you, Mr. Chairman. And yes, indeed, if my colleagues are wondering why we're not calling, or if we're going to call other witnesses on programs such as this early retirement program, I think we need to call the American taxpayer, who is footing the bill for this and is livid with the lack of accountability and the lack of measurable results that they see coming from these programs. It is not hard to understand, in my book, why we would vote to repeal these programs. When you look at this program and the burn rate of this money, I'm curious as to why you have flown through $1.3 billion over the last 2.5 months when you have a total of $5 billion, which was supposed to last you for a few more years. You know, this is a little bit of a head scratcher. Why are you trying to get this money out of the door? Why are there so few people enrolled in this program? Why is it not giving the results that are necessary? And of course, as I've said many times, there is no successful example of public option health care being implemented and achieving a savings, either a near-term or a long-term savings. The wasteful spending has to stop. The American taxpayer has grown ill and fatigued with the practices they see in Washington, D.C., and I thank the chairman for calling the hearing. Yield back.
Gentlelady yields back, and the gentlelady from Colorado?
The gentleman from California for 5.
The gentleman from California is recognized for 5 minutes.
Thank you, Mr. Chairman. I've been involved in congressional oversight for decades. I've seen firsthand how oversight can, when it's done right, educate and inform the public and make government programs work better. But I've also seen how the oversight process can be abused for no purpose other than to fight partisan ideological battles. And that's what I see here today. This hearing is ironic because it's about the new state and federal pre-existing condition insurance plans, or high-risk pools, established under the Affordable Care Act. These plans are supposed to be a transition for people who couldn't buy insurance. They can't go to the individual market because the insurance companies won't give them coverage because of pre-existing medical conditions. So we set up some high-risk pools for them until we get to the transition where we will insist that insurance companies cover those people at the same time that we're requiring everybody to be covered, so that costs are being spread so that everybody gets coverage, not the kind of situation we've had up till now where it doesn't make sense for an insurance company to give a policy for somebody with a pre-existing condition because they're just very likely to be expensive. So the insurance companies want to exclude people, not cover people. Well, this is ironic because this is exactly what the Republicans proposed instead of the bill that we passed. You would think the Republicans would love this idea. These high-risk pools were the centerpiece of their health reform. They didn't want to actually eliminate the insurance company discrimination against people with pre-existing conditions. What they wanted to do was to let the insurance companies treat them differently in a high-risk pool. Mr. Burgess, who I seem to believe is an outspoken opponent of the health care reform law, said, quote, "The programs to deal with pre-existing conditions would involve risk pools to be sure, end quote. And Politico described high-risk pools as one of the old GOP standbys. So when we have this high-risk pool to give people care until we transition into the new healthcare system, suddenly Republican leaders decided they don't like them anymore. And why don't they like them? Well, they don't like them because not enough people are taking advantage of these high-risk pools. This hearing isn't about why some are taking advantage and others not. We're not hearing from people. We're only hearing from the administrator of this program, Mr. Barthel, a constituent of Representative DeGette, who is enrolled in one of these pre-existing condition insurance programs, was denied the ability to be here for this hearing. Now, maybe in the next 5 or 6 hearings on the subject, he'll get a chance to come in and talk about it. But Republicans are attacking this program because it's not popular enough and it has too low an enrollment. And then they're attacking the early retiree reinsurance program for being too popular and having enrollment that's too high. There's just nothing you can do that won't bring Republican criticism, because what they see as their job is to whine and complain and attack and confuse people about the health insurance law so that people won't start realizing that it's a pretty good law. It ends the worst insurance company abuses. It helps seniors in Medicare, helps small businesses afford health care coverage, makes sure that all Americans have access to high-quality, affordable health care. Now, they say they want to repeal and reform, repeal and replace. Well, we haven't seen their replacement, but we do know that they did propose some ideas as alternatives, and one of the ideas they proposed were high-risk pools. And now we're having a series of hearings on high-risk pools and why they're not successful enough. These high-risk pools could have been the ones we would have adopted on a bipartisan basis, but they wouldn't work with us to do anything on a bipartisan basis. This hearing is not a serious hearing. This hearing is not really trying to get facts that will help bring about some understanding that could lead to reforms. This is just a partisan show. It is not a legitimate oversight hearing, and unfortunately that seems to be par for the course for this committee, even though this subcommittee is called the Oversight Subcommittee. I think at some point we need to stop these partisan games, learn how to work together for the benefit of the American people.
I thank the gentleman, and with that, there's no additional opening statements. At this point, we'll ask Steve Larson, the Deputy Administrator and Director of the Center for Consumer Information and Insurance Oversight, who is part of the Democrat administration, to stand before the committee. And Mr. Larson, you're well aware that the committee is holding an investigative hearing, and when doing so has had the practice of taking testimony under oath. Do you have any objection to taking testimony under oath?
No, I don't.
The chair then advises you that under the rules of the House and the rules of the committee, you are entitled to be advised by counsel. Do you desire to be advised by counsel during your testimony today?
I don't.
In that case, if you please rise, raise your right hand. I will swear you in. Do you swear to tell the whole truth and nothing but the truth, so help you God?
I do.
You are now under oath and subject to the penalties set forth in Title 18, Section 1001 of the United States Code, and you now give your 5-minute summary of your written statement.
Thank you, Chairman Stearns, Ranking Member.
I think you should put the mic just a little closer,
Closer?
if you don't mind.
Is that better?
I think that is.
Okay.
Yeah, that's good.
Chairman Stearns, Ranking Member DeGette, members of the subcommittee, thank you for the chance to appear before you this morning, and I've submitted my full testimony for the record. As was mentioned, I serve as Deputy Administrator and Director of the Center for Consumer Information and Insurance Oversight, or CISIO, within CMS. I've been involved in implementing many of the provisions of the Affordable Care Act, including overseeing private health insurance reforms, working with states to establish exchanges, and ensuring that consumers have access to information about their rights and coverage options. At this time last year, Congress passed and the President signed into law the Affordable Care Act, which will expand access to affordable quality coverage to over 30 million Americans and ensure individuals have coverage when they need it most. Just 1 year after the Affordable Care Act became law, many reforms have taken effect, including eliminating pre-existing condition exclusions for children, prohibiting insurance companies from rescinding insurance policies simply because a consumer may have made an error on a form, ending lifetime dollar limits on health benefits, and enabling many young people to stay on their parents' insurance plans up to the age of 26. The Affordable Care Act also established new programs to expand and support coverage options as a bridge to 2014. In 2014, everyone will have access to affordable health insurance choices through the new competitive marketplaces, the exchanges, which prohibit discrimination based on pre-existing conditions. The bridge to 2014 includes the Pre-Existing Condition Insurance Plan, or PSIP. The Affordable Care Act created PSIP to make health insurance available to people whom private insurance companies denied coverage because of their pre-existing conditions. The presence of a pre-existing condition is one of the major barriers to obtaining health insurance for individuals. And the fact that so many people are denied coverage for these conditions is yet another reason why health care reform is so important. PSIP provides health coverage options for people who have been uninsured for at least 6 months, have a pre-existing condition, or have been denied health coverage because of the condition, and are U.S. citizens or are residing in the U.S. legally. The program covers a broad range of health benefits, including primary and specialty care. PSIP eligibility is not based on income, and the plan does not charge people higher premiums because of their medical condition. Previously, many states have run high-risk pools or other programs that offer insurance to people with pre-existing conditions. While the PSIP and existing state pools cannot be combined, states have the option to build on their current programs and choose to run the new program under contract with HHS, or elect to rely on HHS to provide PSIP coverage in their state. 27 states run state PSIP programs, and HHS, along with the Office of Personnel Management and the Department of Agriculture's National Finance Center, are running the federal PSIP programs, which cover 23 states and the District of Columbia. The federal government is contracting with the National Insurance Plan to administer benefits in those states covered by the federal PSIP program. And we're flexible about how each state chooses to implement the state program, allowing every state-administered PSIP to be uniquely tailored to their local market. The law appropriates $5 billion of federal funds to support PSIP beginning on July 1 through July 1, 2010 through July 1, 2014. And an allocation of these funds was made across the states based on the CHIP formula that takes into account the population of the state, the number of uninsured in the state, and local cost factors. A 10% cap limits administrative expenses in the PSIP program over the life of the program. And SOCIO and the states work together to monitor expenditures to ensure we're maximizing the value of the program while staying within the 10% administrative cost limit and within the total funds that were allocated. Based on the data released in March, PSIP has 12,437 members. Of this total, over 8,000 people have been enrolled in the state-run PSIPs in the 27 states, and over 3,000 have been enrolled in the federally administered PSIP in the 23 states. I'm very pleased that enrollment in the PSIP program increased by over 50% in the last few months, and we expect it to continue to grow between now and 2014. I'm proud of all that we've accomplished over the past year and look forward to 2014 when Americans will have access to more affordable, comprehensive health insurance plans without worrying about pre-existing conditions. PSIP is an important part of the bridge to the exchanges in 2014. Until then, I look forward to continuing to implement the Affordable Care Act and strengthening SOCIO's partnership with Congress, the states, consumers, and other stakeholders across the country. Thank you so much for the opportunity to discuss the work that SOCIO has been doing to implement the Affordable Care Act and to help people with pre-existing conditions, and I look forward to your questions.
Mr. Larson, thank you very much. I'll take the opportunity to ask the first set of questions. As you know, as everybody in the room knows, this is an oversight investigation committee that's looking at high-risk insurance program. And I thought I would, before we start on that, a recent AP story just came out this morning indicating that your office has given out large sums of money under the early retiree health care program. You're familiar with that program?
I am.
And you were cited as the center of the person who was involved with this. And so we wanted to just in passing, ask a few questions that it appears that a lot of corporations, including General Electric, got $36 million for their early retirees. Appears the United Auto Workers got over $200 million. Verizon Communications got $91 million. AT&T got $140 million. And so the list goes on, and it's a huge amount of money that you're giving out to subsidize retirees, early retirees. And I guess the question is, how can you justify giving out so much of taxpayers' money to these corporations?
Sure. Well,
these are profitable corporations.
The early retiree reimbursement program, in fact, has been an incredibly successful program in accomplishing the goals that it was set out to accomplish. The fact is that history has shown that the rate at which large companies are dropping coverage, insurance coverage for early retirees.
These are corporations that are profitable. And when you talk about AT&T and General Electric and Verizon Communications, United Auto Workers, why would they need taxpayers to subsidize them? And why you have Northrop Grumman, Boeing Company, the State Teachers Retirement System, Ohio. I mean, if this is a program, a health care program that's going to work, why would you be taking taxpayers' money and giving so much out to companies that are very successful and have a very good, profitable history?
Well, those companies are companies that, in fact, continue to offer retiree benefits, health benefits for early retirees.
But shouldn't they have the responsibility of taking care of that themselves, not ask for the taxpayers? I mean, basically giving them free money.
Well, the program allows them and positions them to continue to offer this critical benefit to early retirees, because I'll tell you, early retirees, folks that are between 50 and 65, when they're put out into the individual market, are the ones that are most at risk for not being able to get
Well, I understand
insurance.
that, but that was part of when they got to work for GE or AT&T or Verizon. This is part of the package they understood. I guess, are you going to give money out like this to all major corporations, all the unions, all the public employee retirement system? I mean, I think the point would be that you think this health care system that we passed, the Democrats passed, is so successful. Why in the flip are you giving out so much money of taxpayers so freely and overwhelming to companies that are very profitable?
Well, I'd respond with a couple of points. First of all, there are a number of different types of recipients. Certainly state and local governments are also one of the main recipients, so that employees and retirees of state and local governments can continue to have retiree benefits.
Okay, but Mr. Larson, I have a statement from you. You said the overwhelming response to this program demonstrates exactly how broken the current health care system is, exactly why we needed reform in the first place. Is the reform you're talking about is taking taxpayers' money and giving out to successful, profitable corporation? Is that your definition of why we need a health care bill, the Democrat health care bill?
We think the program is successful because it has allowed these companies and state and local governments and nonprofits and commercials to continue to be able to offer coverage for early retirement.
Now, you followed the recent publicity with General Electric paying no taxes and the huge amount of money they paid. So, as I understand, you gave General Electric $36 million to help their early retirees. Do you think it was absolutely necessary that taxpayers fund early retirees for General Electric? Is that your position today?
Well, when a sponsor in the program receives the money, it must apply the money to the benefits that are received by the retirees, or to the costs that the company
Okay, I
incurs.
understand. My time's almost expired, but let me just move on to what we're here for also is the high-risk insurance program. Enrollment in the high-risk pool was supposed to be about $375,000 in the first year, according to the chief actuary of Medicare. Is that correct?
That's my understanding. Yeah.
Okay. Based upon what we've seen so little, as you saw in my opening statement, how can you justify this cost if you've only done so little at this point? Where are you going to get the money to do this high risk for everybody?
Well, it's been a fact across the country as states, and certainly for the federal high-risk pool, is that the pools are generally slow to start up. When the bill was passed, we devoted our efforts to standing the program up.
I'll just close by saying, if you've only got 12,000 in the program today, and you've indicated 375,000 people is your goal, and you spent this huge amount of money on 12,000, you won't possibly have enough money to do 375,000.
Well,
wouldn't you and I agree that you won't have the money to do 375,000 based upon just the 12,000 you've done?
I don't think, respectfully, we agree, because we have not spent a large amount of money on the program to date.
Okay. All right. My time has expired. The gentlelady from Colorado.
Thank you, Mr. Chairman. Mr. Larson, how much money has the program spent to date?
For outlays or incurred expenses associated with
either one,
the federal program
yeah,
and the state program combined is about $33 million as of February 28th.
Okay, and how much was set aside in the health care bill for this program?
$5 billion.
$5 billion. So you've spent several hundred million of the $5 billion.
Well, we've spent about $33 million on what I'll call program costs, and then additional funds on administrative costs, but together it's less than $100 million.
Okay, it's less than $100 million of the $5 billion, correct?
That's correct.
Now, you're making efforts to try to enroll more people with pre-existing conditions in this program, correct?
In fact, I think they've been successful.
And why do you think that?
Well, we had several phases of enrollment initiatives. The second phase started from January to March, in which we conducted outreach with staff, by the way, just with SOCIO staff, hitting 9 cities, talking with providers. And we've seen enrollment double, increase by 50% between November and February. So we've made those efforts, and enrollment is going up.
So is your projection you're going to wildly exceed this $5 billion before the 2014?
I don't think we're prepared to say that yet.
Okay, thank you. Well, that's what the chairman's implying, but you've spent less than $100 million.
No, we will work within the appropriation.
Thank you. Now, let's say, let me just ask you one question. I know the topic of this hearing is about the PSIP program, but let's talk about this early retirement reinstatement program for a minute. What was happening was a lot of employers who had early retirees retirement programs were cutting those health care programs when the economy turned down, right?
That's right.
So then what would happen would be people between age 50 and 65 wouldn't have insurance, and they'd have to go out on the individual market, right?
Correct.
And so then those people couldn't get insurance, right?
Correct.
So that's what this is designed to help. Is that correct?
That's correct.
And that program is also going to phase out by 2014, right?
Yes.
But at this moment, it's helping. We can't, Congress can't require these companies to continue those programs for their early retirees, can we? No. And so therefore, the people that this program is helping are those early retirees who have no other way to get insurance, right?
And there are millions of people that are covered in the retiree programs that have been helped by this program.
Right, and that it helps them get insurance.
It helps them keep their coverage.
Yes, okay. Now, let's talk about the subject of this hearing again, the PSIP program. Before the health care reform bill became the law of the land, let's say somebody was diagnosed with cancer and they wanted to buy health insurance on the private insurance market. What sort of options would those people be offered?
Well, they're generally limited to the individual market, which they would be either offered exclusionary riders or denied coverage.
So you mean the individual market would say, we're not going to cover you for your cancer because it was pre-existing, right?
That's correct.
Let's say they wanted to get coverage for the cancer. How much would that cost them?
Well, I don't think they could get coverage for that without going to like a state high-risk pool.
Okay, and let's talk about the state high-risk pools. How many state high-risk pools, or how many states had high-risk pools?
I think there's about 35 that had state high-risk pools.
Okay, and where in those 35 states were they providing affordable coverage to everybody who needed it?
Well, the difference between the PSIP program and the state high-risk pools is they often have a standard rate that's up to 150% or 200% of the market
state
rate.
program.
The state program, which is not the way the PSIP program is structured.
Okay, how is the PSIP
PSIP program has a cap of no more than 100% of the standard market rate. So the state programs, although available, are often viewed as not affordable for some people.
Okay, I just have one last question. What would happen to these PSIP plans if the Affordable Care Act was repealed?
You'd have a lot of people that have no good option to get coverage, and these are the sickest of the sick in many cases.
Their plans would be canceled, right? And then they would have to go to these other options you talked about, right?
That's correct.
Thank you. Thank you, Mr. Chairman. I yield back.
Lady yields back. The gentleman from Texas, Mr. Burgess, is recognized for 5 minutes.
Thank you, Mr. Chairman. I don't want to spend too much time on this, but I feel obligated to answer the ranking member of the committee. It always seems that they want to paint Republicans as the friend of the insurance companies. Just a quick review by a simple country doctor on his iPhone app tells me that Cigna and Aetna have done extremely well in the year since the passage of the Patient Protection Affordable Care Act. Apparently, when people are required to buy insurance, the companies that sell insurance seem to be able to manage okay. Let's talk for just a minute, because you were giving Ranking Member to get some information about the amount of money you spend in the program. You said $100 million. Is that correct?
No, I said no more than that. The approximate number would be the program spending of about $33 million, and then administrative costs of about 25, which includes a significant portion of startup costs that you incur anytime you start up a major program.
Yeah, I'll accept that, but that does seems a little bit. $33 million in benefits, is that correct? Did I understand that?
Well, remember, these are the amounts that are paid to the states or to fund the federal program beyond the premiums that are collected from the folks that are covered in the programs. But that's the level of federal spending for the program combined for both the state and federal.
So that combined help for people, $33 million against a backdrop of $25 million in administrative costs. Is that correct?
Well, again, the $25 million, there's at least $10 million of kind of one-time.
Yeah, you know, this would all be easier.
Costs.
We talked about this before. Boy, if we had a breakdown of your budget, it would just be so helpful. And you promised that to us, and you know, I'm having to ask these questions because I don't have that information yet.
It is my hope and expectation that you will have that next week.
Next week, okay. So we'll mark the calendar, and we're all anxiously awaiting that. Now, you previously testified you added 300 new jobs to implement the program. Is that correct?
Not just this program. That's
but the whole
for all of SOCIO, right? That's correct.
So
less than 300.
Do we know how much you spent on salaries for those 300 people?
I'm sorry, could you repeat the question?
The amount you spent on salaries for those 300 jobs?
I don't know off the top of my head.
Well, is that money coming out of the administrative or the non-administrative funds?
Oh, you mean the salaries that administer that would be in the administrative portion. It's a very lean and small staff that administers the PSIP program.
Now, on the issue that's come up, and unfortunately we haven't had a lot of time to work through it because of the retiree program information that's come through this morning, but 8 of the 17 companies had more than $10 billion in profit last year. I mean, are those not companies that could have afforded to do some of this on their own?
Well, I can't speak to their capability. I can only say that, as I mentioned earlier, when they receive funds through the ERRP program, they are required to devote those funds to either reducing their own costs or reducing the costs of the beneficiaries. And I think 80% direct the funds to directly lowering the costs of people that participate in the program. So we think that's a success.
Yeah, but you've got a big company whose initials I won't mention, but they haven't paid any taxes this past year. They post an enormous profit, and you're providing them $36 million. And, you know, the only problem with that, and I want to help people too, but we're borrowing 42 cents out of every dollar we spend. So was there a way to perhaps tighten this up and run it just a little bit leaner? And, you know, even Karl Marx said, each according to his ability, each according to his need. That's a non-responsive response. It's very difficult for the recording clerk to record that. Let me just ask you one more question. Was it, I mean, I have no problem with risk pools. I think the state risk pools, although they were underfunded, certainly provided good help. And when I would do town halls and talks in my district and even talking to doctor groups around the state, someone would always come forward and say, you know, don't do anything to mess up what I've got with this risk pool. But at the same time, why was it necessary to reinvent the wheel? You already had said that you had 35 of the states with something out there in a risk pool arrangement. You have additional states that have reinsurance programs, so you're already getting to a pretty significant number of the states already. And now we come and overlay a federal program. Haley Barber, when he was here, actually testified that he had 3,600 people on his risk pools in the state of Mississippi, and with the infusion of he did not participate at the federal level, but what the additional federal funds at a significant cost were able to provide additional benefits to 58 new people. It almost seems like we're not being smart about how we're spending this money.
Yeah, well, I guess I have two responses. First, I'd say that this is a complement to the state pools because it has different design elements. For example, often the state pools have waiting periods before they start to cover pre-existing
Yours is 6 months.
Well, it's a little different for the federal program. That's you can't have been insured for 6 months because we didn't want people migrating across pools. So in the state pools, you often have a waiting period so that even if you come into the pool, you don't have coverage necessarily right away.
6 months seems like a waiting period.
And then as we discussed earlier, typically the standard rate for the state pools is 125%, 150% or higher. So there are features of the federal program that complement what is going on at the state level.
I get that. It just seems like it would have been better to streamline those two together rather than reinvent the wheel.
Gentleman's time has expired. The gentleman from Michigan, the emeritus of the committee, Mr. Dingell, is recognized for 5 minutes.
Thank you. Thank you, Director Larson.
I think you'll have to pull the mic a little.
Implementing the Affordable Care Act. You have a large task before you, including the Critical Patients Bill of Rights, the state-based exchanges, as well as today's focus, the pre-existing condition insurance plan. I appreciate the work that you have done in getting the pool up and running in Michigan, including the work you've done to make a difference in the lives of Michiganders like Jerry Garner, whom you pointed out in your testimony. Now, as my colleagues on the other side of the aisle question the effectiveness of high-risk pools, I think it would be useful to remind them of the strong support of these pools as a way to expand coverage. In fact, members of this committee offered their own legislation appropriating far more money than laid out in or expended in the Affordable Care Act to implement high-risk pools nationwide. Now, Director Larson, a few questions. Please answer yes or no. The PCIP was designed to be a temporary program to help the sickest of the sick and those most in need, to have access coverage to coverage until health insurance exchanges are up and running in 2014. You point out that more than 12,400 individuals have enrolled in these programs across the country. In your experience, have the states been able to set up affordable premiums for individuals in need, yes or no?
Have states been able to set up affordable programs?
Yes.
No, they have not completely.
They have not. You point out in your testimony that CCO recently adjusted the federal PCIP program to reduce premiums and to add 2 plan choices. You point out that the enrollment in PCIP programs has increased by 50% from November to January, from November to February. In your opinion, will increased plan choices in the PCIP program encourage further enrollment, yes or no?
Yes.
Now, you also discuss in your testimony the outreach efforts of CCO that have been used to encourage enrollment, working with Social Security Administration, American Cancer Society, Diabetes Association, and other agencies. It is my opinion that it seems to be a very targeted approach in enrolling in individuals. In your opinion, do you believe this targeted approach is working, yes or no?
We think it is showing results and working, yes.
Now, how do you know that this targeted approach is working?
Well, as I mentioned and referenced, we've seen significant increases in the rate of enrollments in the period between November and February. In addition to the overall enrollment, there were several states in which the number of individuals in the program doubled. Okay. 5 or 6 states that doubled their enrollment in that period, so it's very encouraging.
Thank you. Now, is every PCIP program conducting a public campaign to recruit eligible individuals, yes or no?
Yes.
Now, has CCO shared the best practices with the states who have lower enrollments than others to help them recruit eligible individuals they may be missing, yes or no?
Yes, we're in constant contact with the states.
Is, in your opinion, has CCO learned some best practices in terms of enrolling eligible individuals that will help to ensure successful enrollment of individuals in the exchange beginning in 2014, yes or no?
Yes.
Now, am I fair in observing that when the situation in 2014, when everybody is covered in the exchanges, am I assuming correctly that at that point it will no longer be necessary to have this high-risk pool?
That's correct.
Okay. Now, would you like to comment, if you please, sir, in the very brief time that we have, on what are the best practices or any other comments that you might like to make with regard to the previous questions?
Well, as you mentioned, we've learned that it really is a targeted outreach campaign. This is not necessarily mass marketing, so that you work closely with high-volume providers, hospital associations, medical associations. We've worked with the insurance companies that issue denial notices to take note of the availability of the PSIP program.
Now, one very quick question. The companies that you have helped have had no responsibility other than their contractual responsibilities to cover either their active employees or their retirees. Is that correct?
Yes.
Thank you. Thank you, Mr. Chairman. 1 minute, 1 second left.
I thank the gentleman from Michigan. The gentlelady from Tennessee is recognized for 5 minutes.
Thank you, Mr. Chairman. Mr. Larson, I want to cut right into this. What are the standards on your application, and what does your application look like for these companies that apply for this money for the early retiree process?
Well, first they have to submit an application to be a plan sponsor, requiring basic information about the plan, about the company and their retiree plan, and then in the process of submitting claims, then they have to submit claims information, and as you may know...
Okay, well, they submit a claim to be they submit an application to be a plan sponsor. So do they need to show financial need when they submit an application to you, that they need this money, that they're short of money, that they're not going to be able to cover the cost of those that are enrolled in the plan that they are choosing to sponsor? Do they have to demonstrate that financial need?
The statute doesn't require a needs test.
How long is the application they submit?
It's not particularly long. I don't recall.
Okay, so they don't have to demonstrate any financial need. They just need to show that they want to set up a plan for their early retirees. Is that correct? They
need to demonstrate that they have a current program to cover their early retirement.
So they have a current program. Okay, let me ask you this. Some of these companies have early retirees that they may have incentivized to take early retirement. Do you ask them how they achieved their universe of early retirees? Did they incentivize these people, give them early parachutes, early retirement parachutes, give them extra benefits if they chose to retire? Do you ask them if they're doing that?
I don't believe that's part of the application.
It is not part of the application. So therefore, in order to make their bottom line look better, they could actually go to a universe of employees and say, we're going to incentivize your early retirement, and then move them into this plan that they're going to submit an application to sponsor, then come to you with their hand out and say, hey, we need your millions, federal government. Do you not see why the American people are so frustrated with what you all are pouring out of these bureaucracies every day on the American taxpayer? I mean, is this lost on you?
Well, first of all, I don't think we've
You've
seen...
spent $100 million in setting up a program we don't want for services we don't need, giving money to corporations that are profitable corporations, giving money to people like GE who are exporting their power job growth, giving money to people like GE who are no longer making light bulbs in the United States but have shipped all those jobs to China. And you think this? You think we should be happy and pleased and applaud you for creating new federal jobs to take money out of the taxpayers' pockets? Let me ask you something else. Let me move to the PSIP. Let me move to the PSIP program. I don't want to run out of time. Did you have any existing program that you used for a model when you set up PSIP? Was there any program in existence that you went to? You've already said you didn't think the states were doing a very good job with their high-risk pools.
Well,
So-
I don't think that's quite what I said. I said that there are 35
said it was
state
incomplete.
programs. I'm sorry?
I think you said they were incomplete.
No, they have different sets of standards, and the federal standard is different. So we certainly looked to the way that the high-risk pools were
Yes, yours has
administered.
different design elements, was
Correct.
your exact word.
That's right.
Okay. Is there any program that you have looked at that you think has been successful? When you have a state like Tennessee, and you and I have discussed Tennessee before, we've been down this road. We know public option health care does not work, that it breaks the bank. And we know where some of the pitfalls are, but you all are not willing to listen to some of that guidance. So, have you seen, did you work from a model that has actually yielded a savings?
Well, high-risk pools, by definition, will not yield savings. They
should reduce cost.
Well, here's the problem. When you're insuring sick people, you can't collect enough premiums to cover the costs. And so high-risk pools are always subsidized in some way. Typically, in the states, it's subsidized through assessments on insurance companies or general revenue. In this case, it's subsidized through the PSIP program for the federal and state.
Do you think that putting a federal program alongside a state program, even though it has, in your words, different design elements, is redundant?
No, I don't.
You don't?
I do not.
You don't see a problem with the duplications?
No, because I said I think we attracted a different element of the population that has pre-existing conditions. So it's complementary.
So in other words, you
to the
think the
program.
federal government needs to pick these programs up and pull them to the federal level, not trust the states for oversight, and then turn around and out of your $5 billion, give it to corporations who don't need the money, who are firing American workers and shipping the jobs overseas. I yield back.
Gentlelady yields back. The gentlelady, Ms. Jan Schakowsky, is recognized for 5 minutes.
Well, I am just loving this debate. I particularly appreciate Dr. Burgess quoting Karl Marx in his rationale on why this program really doesn't work, and I appreciate hearing the fury about companies that don't pay taxes and then outsource jobs, and I would certainly endorse those concerns and would certainly welcome an opportunity to work with my colleagues across the aisle to address just that. The problem we have is that these greedy companies that legally don't pay any taxes also are not increasingly dropping early retirees from these health care programs. Is that not true, Mr. Larson?
That's correct.
So we have seen that while all this outrage may be going on with no solutions, we could sit down and establish criteria for companies that when they make a certain amount of money must provide this kind of coverage for early retirees. I welcome that conversation. But in the meantime, are we going to sit here and say the burden then will be on the shoulders of those very retirees who, in many cases in the past, used to get help from their companies who aren't? And the problem is that these are, in fact, very, expensive people to insure, these high-risk people, and that is precisely why we passed the Affordable Care Act and why in 2014 we are going to prevent discrimination. Is this not a bridge program, Mr. Larson?
That's exactly right.
And what would happen to those retirees if we did not provide that?
I think they would have great difficulty finding coverage in the individual market.
So if there's another solution that my Republican colleagues would like to find to require corporations to pay their fair share of taxes, to come up with a way to force them to cover their retirees, then why don't we talk about that? I haven't heard anything like that except a criticism now in Marxian language of what these nasty outsourcing corporations are doing. Would the chairman?
I would be glad to. I think repeal Obamacare and start anew and try to come up with a health care plan that every American would support.
And put every American at risk again. When we have a plan that we would be happy to look at various ways to make it better. In the meantime, Mr. Larson, I congratulate you on this program to make sure that we aren't setting adrift the victims of some of these very corporations that the Republicans have supported. You know, in the Medicare, let me find it. There was a loophole created in 2003 with the Medicare Modernization Act that allowed companies, this is a Republican initiative, to receive a 28% subsidy from taxpayers to help cover the cost of prescription drugs for retirees without counting the money as income. And when they spent the money, then the companies were allowed to turn around and get a deduction for it on their taxes, even though the money was a gift from taxpayers. There was no outrage from the Republicans who wrote that provision into the legislation that the Obama administration saw as a double subsidy from the taxpayers. But now, at the very moment, we're looking how to get these vulnerable employees to make it to 2014. Now, we're looking at these rich corporations and how are we letting them get away with it. Well, if there is a way that they suggest that we can get GE and AT&T to cover those, I welcome that. And until that point, we're not going to set those employees adrift with no health care coverage. And I yield back.
And the lady yields back. Dr. Gingrey is recognized for 5 minutes.
Mr. Chairman, thank you. Mr. Larson, Ms. Blackburn was just trying to point out something to you in regard to a lot of these companies and one in particular. I won't name the company, but the initials are GE, in regard to these early retirement incentive packages that they give to their advantage, to the advantage of their bottom line. That's the only reason why a company would do something like that. But what it amounted to was a lump sum early retirement bonus worth 75% of their annual pay. And her outrage, of course, was over the fact that when these companies do that, and then they say they come to you, to the federal government, with this ERP program, ERRP, and say, oh, sign us up for the money to help us now pay these same people for their health retirement benefits. So that's where the outrage is coming from. CMS just released a new report yesterday announcing that this program, Early Retiree Reinsurance Program, ERP, created under Obamacare, it spent nearly $1.8 billion in reimbursements, which have helped preserve the availability of health benefits for early retirees and reduce increases in plan participant costs. In deference to my limited time, that I have a series of questions, and if you don't mind, please try to answer yes or no on these, Mr. Larson. Number one, does the Center for Consumer Information Insurance Oversight oversee this early retiree reinsurance program for CMS?
Yes.
And you are the Deputy Administrator and Director of the Center for Consumer Information?
That's correct.
Was the early retiree program created in PPACA, otherwise known as Obamacare? Was it created?
It was part of the what we call the Affordable.
The answer is yes. Thank you. Next question. The law appropriated $5 billion to pay the claims for early retirees, correct?
Yes.
That is the same amount appropriated to the high-risk pools for people who cannot obtain insurance. Is that correct?
Yes, there's a separate appropriation.
Essentially the same amount, yeah. CMS just released a report yesterday announcing that it had spent nearly $1.8 billion of the $5 billion appropriated to date. Is that correct?
For the early retiree program?
Yes.
That's correct.
Next question. I'd like you to go over some of the payments made in the $5 billion early retiree program with you. My staff has presented you with a copy, and thank you, Robert, tabbed, numbered, highlighted. Again, a simple yes or no answer, please. Did AT&T receive $140 million from this retiree fund?
That's my recollection from...
Are you aware that AT&T filed a $1 billion loss with the SEC on March 26th of last year, and in papers accompanying the filing charged the losses stemmed from the passage of Obamacare?
I'm not familiar with the reference.
Well, the answer is yes, they did. Are you also aware that AT&T stated in its March 26th SEC filing that it would be forced to evaluate prospective changes to the active and retiree health plan benefits offered to their employees?
Again, what we've focused on and trying to make sure is that these companies that get this money continue to...
Mr. Larson, in the interest of my time, the answer to that question is yes, they did. Did Valero Energy Corporation receive over $1 million from this retiree fund? You've got the information in front of you.
Well, if you want me to flip through the list, I can. I don't have all the recipients memorized.
Well, in the interest of time, I'll answer that one for you, too. Yes, they did. And are you aware that Valero Energy Corporation filed a $15 to $20 million loss with SEC on the same day as AT&T, once again citing Obamacare as the reason? And the answer to that, since you're a little slow on it, is yes, they did. You know, the whole point here of my line of questioning, Mr. Larson, is this system, this ERRP, Early Retiree Reinsurance Program, to me is just a makeup for the money that was taken away from corporations. It was given at the time of the Medicare Part D prescription plan was put in place to keep them from dropping their retiree health insurance plans. It's a kiss and make up, which is ridiculous. They should have left that program as it existed, but they had to have money to generate and a score from the CBO to pay for this whole new entitlement program. So that's the line of my questioning and the point of it. I'm over time now, so unfortunately I'll have to yield back. Thank
Gentleman yields back. The gentleman from Texas, Mr. Green, is recognized for 5 minutes.
Thank you, Mr. Chairman, and I'm glad my good friend from Georgia pointed out two Texas companies. Valero's headquartered in San Antonio, and AT&T used to be San Antonio. Now they're Dallas, somewhere up there, but they got that assistance. But I served on this committee in 2003 when we considered the prescription drug plan. And, you know, it's almost like deja vu all over again, because the same issues were brought up then, that a lot of companies who had retiree prescription drug plan were all of a sudden benefiting from this. And so I just want to point that out, but the shoe's on a different foot this time. But I appreciate you being here, Mr. Larson. Thank you for appearing. I'm from the state of Texas, as I said, and we already have a high-risk pool. It's been operational since 1992 and covers 27,000 Texans. How many states currently operate their own separate pool from those established by the PPACA?
Right. I believe it's about 35 states.
Okay. Were these states given the option to move the individuals currently in their high-risk pool program over to the new high-risk pool established by PPACA?
Because of the different rules between the state and the federal, it runs in parallel to the state pools. But states can set up a PSIP pool.
If the states set up a PSIP pool, they would not have to have their own pool.
Well, they have their own pool, which has one set of rules, and they have the federal, they have the PSIP pool that they run under a contract with HHS, and they design, subject to the standards in the ACA, the rates and the benefit design. So there's a state-run pool, and then a different type of insured, if you will, is eligible for this pool?
One of the concern I have is the slowness of the number of people who are signing up for high-risk plan, and I'll give you my understanding of what happens in the state of Texas. Texas was given the option to establish a high-risk plan under health reform, and our governor declined, citing a financial burden on the amount of federal funds received. And Texas continues to operate its own high-risk program. Last year, a number of us sent a letter to Secretary Sebelius asking states who opt out of PPACA establish high-risk pools that we would have a similar exchange, similar to exchange in Texas. We would have an option for PPACA in Texas, and I'm going to go into that in a few minutes on the benefit. In 2009, before we passed the Affordable Care Act, Texas received $10.5 million to run their current high-risk through grant program funding through Congress. That's nearly $6 million more than any other state, and to fund their program. And what we found out under the state program, the average premium for a Texan participating in a high-risk program must be twice the average premiums for a healthy individual in the market. Is that true with other 29 states, that they have something like that?
Something like that. Not all of them are 200% or twice as much, but they are generally substantially above the market rate, and that can create affordability issues.
Well, and that's the problem we have. For example, the premium for a 40-year-old woman in Houston, where I represent, under the Texas high-risk pool, is about $750. Under the PPACA plan, that same woman would only pay $387 a month. Why would anybody sign up for a state plan when they could actually save almost $300 or $400 a month?
Yeah, well, there is one limitation that was in the ACA regarding the PSIP program, which is that you not have insurance for 6 months.
Okay.
So the people that are eligible for the PSIP program are people that have had nothing up until the implementation of the program.
So if somebody was under the state plan, they would have to wait 6 months before they could apply for PSIP?
That's correct.
How many states have that 6-month plan, do you know of, in their current program, in their separate program? Do you have to be without insurance for 6 months?
Well, every state that administers a PSIP pool has to abide by that same 6 months.
But what about their separate state plan? Do they have, do states have something comparable?
Typically, it's more that there are waiting periods or exclusionary periods so that you can sign up right away, but you may not have coverage. That's to avoid people circulating in and out of the pool when they're sick. So there are waiting periods for coverage for your high-risk condition.
Well, I understand, although, you know, I have folks on Social Security disability, once they receive disability, they have to wait 24 months before they can get Medicare. So 6 months is a long time, but not near 24 months like we have under Medicare for disabled folks. Under the PSIP, Texas would have benefited by about $493 million to run a high-risk pool. Is that true?
I'm sorry, I didn't.
$493 million under the PSIP program. Texas would have benefited by receiving about $493 million to run a high-risk pool from the federal government.
Well, that may be the allocation to Texas across the life of the program. I'd have to go back and look at the numbers that you're referring to.
Gentleman's time has expired.
Well, thank you, Mr. Chairman. I was just asking for some information because it's so we can find out what we need to do to make sure our constituents get the cheapest program in a high-risk pool. Thank you.
Yeah. I advise all the members we have a series of votes. We'll reconvene right after the votes at probably between 12 and 12:15. Mr. Larson, we're going to continue with another series of questions, and then we'll reconvene, recess, and come back. Mr. Bilbrey is recognized for 5 minutes.
Thank you, Mr. Chairman. It was interesting, the reference you made right off I think the second or third paragraph, where you were pointing out that there are U.S. citizens or otherwise those who are legally residing in the United States, and I think you clarified that all U.S. citizens residing in the United States are legally present. But my question is about the verification. Well, first of all, let me back up. You made a reference to the fact that there were how many states that were allowing you to administer their program?
23 states and the District of Columbia.
Okay. Do you realize that about 65% of those states are states that have basically told us to go to hell and are engaged in the blocking? So a lot of that participation, 65% of the participation, looks like it is not trust in the federal government to administer the program, but basically a position that they don't want to participate in the program in any form.
Well, I can't speak to their motives for not participating, but I know that we administer it in 23.
But 65% sounds...
yeah, I don't know.
Okay. The verification system, you make a statement about the that only those legally in the country are participate in the system. Is there a reason why we didn't use the SAVE verification that we use for all other programs, benefit programs in this country now?
I'm not sure what your question is.
My question is, why aren't we using the verification systems for this benefit that we use in other benefits in the federal system?
I'm not sure that we aren't.
Well, let me double back here. Do you require biometrics for identified foreign nationals to participate in the program?
I would have to get back to you on the details of the verification.
Okay, I would question the fact that because we don't use SAVE, no, there is no biometrics. Now, I understand that U.S. citizens, or people who claim to be U.S. citizens, just have to state their name, their Social Security number, and their date of birth, right?
But I think we still verify that information.
You verify them through which documents?
I'll have to confirm with you exactly how.
Okay, I'm just saying that you don't use biometrics on the United States, but you do not use, are you aware you're not using biometrics for stated foreign nationals to participate in this program?
I don't know the answer to that.
Okay, well, let me just say for the record, there's no reason why anyone who says they are a foreign national in the United States that we should not have biometrics as a requirement, because every foreign national that I know of, and someone correct me, but at least the overwhelming majority of foreign nationals in this country have biometric confirmable identification, and we're not using that technology right now. This is one of those issues of someone saying just because you say that somebody legally in the country is not participating, if you don't have appropriate verification, you can't sit here before this committee and make a statement like that with any degree of certainty. It is what you may think might happen, or you hope may happen. But I think we need to clarify, without the verification systems, we are lying to the American people, and I don't care who it is, the guy at the top or the guy at the bottom, to look at the American people and say, I can assure you that people illegally in this country are not participating in this.
Well, I'll be happy to follow up with you on that.
Okay. I appreciate that. Mr. Chairman, I yield back.
Okay.
Will the gentleman allow me just to
the gentleman.
We're going to recess, but I just have a question, Mr. Larson. If it turns out a company gets, or a state gets a waiver from Obamacare, would you still give money to early retirees even though they got a waiver from all the health care provisions? Just yes or no?
Well, I don't. Which waiver are there?
Well, let's take
there's only really one.
Like the state of New York got $47 million. So the question is, the state of New York is putting in for a waiver. Did they get their waiver yet, the state of New York?
You mean their waiver from their annual limits?
Yeah. Yes.
Requirement?
Yes.
I'm not sure.
Okay, but let's say hypothetically, if the state of New York got the waiver, would you still go ahead and give money to early retirees?
Right, but the waiver that they get, or a state can get on behalf of carriers, insurance carriers in the state, is not a waiver from the provisions of the Affordable Care Act. It's a waiver from that one narrow provision.
Okay.
So they wouldn't be ineligible for example.
So the waiver does not apply, then extend to the requirement.
Yeah, it's a very narrow provision.
I see. Okay. Thank you for that clarification. With that, the subcommittee will recess and come right after the vote, which hopefully is between 12 and 12:15. This will return to the table, and I think our next member is Ms. Christensen. You are recognized for 5 minutes.
Thank you, Mr. Chairman. And thank you, Mr. Larson, for not only being here, but for the work that you're doing to make sure that those who could not receive insurance otherwise are receiving it. I just want to say for the record, though, that I really regret that we were unable to include the territories in this, because we are U.S. citizens, and there are many of our constituents in the territories who are unable to get insurance because of pre-existing disease. But before they had even heard your testimony, the majority of this committee was already attacking the PCIP program for being too expensive. But the fact of the matter really is that it's going to run very efficiently as I see it. In fact, it's my understanding that the administrative costs for the program are capped at 10% over the life of the program. Is that correct?
That is correct.
And do you expect to stay within that cap?
Oh, we will stay within the cap. And we are ensuring that the states will stay within the cap as well.
Thank you. And there have also been some concerns that the startup costs have pushed the initial costs of the program above projections. So can you give us some perspective on these startup costs and how they compare to startup costs for other programs like Medicare Part D?
Well, first let me clarify that I'm not concerned that the startup costs will push us over any projections. It's simply that they represent in the first 6 months of a program a disproportionate amount, but over the life of the program, which is the statutory standard for the 10%, you know, we will be within the 10%. But
thank you.
I mean, the startup costs are things you might imagine, such, you know, programming, hiring people initially, getting the scripts ready for the call centers. So there's kind of a lot of one-time things that you have to put into place.
Can you compare them, your startup costs, the Medicare Part D program?
You know, I'm probably not in a position to do that because I'm not as familiar with those startup costs.
And how does a 10% administrative cost compare with what we would see in the private insurance market?
Well, in fact, under the medical loss ratio standard, we provided, you know, headroom, if you will, for 20% of administrative costs and 80%. So it's quite a bit tighter than what we're even requiring for the private insurance market.
Right. So this sounds like an example of government-run healthcare working pretty well, and it's providing critical access to health insurance for people with pre-existing conditions and doing so in what I think is a lean and efficient way. But there have been certain media accounts of the program, as well as some of the comments I've heard from across the aisle that suggest that at the current rate, the PCIP plans in some states will run through their funding before the program ends in 2014. Are you concerned about that happening?
I'm not concerned about it. We have the ability to address the specific rates that states draw down on their initial allocations. Certainly, I think as we announced, New Hampshire was a state that was running ahead of projections, right. But we have other states that are running behind projections. And again, we have the ability to manage the funds within the allocations and within the $5 billion. So I'm not concerned about the fact that there may be one state or a small number of states that are ahead of projections.
So thank you, Mr. Larson. It sounds to me like the program enrollees and the American people will be getting a substantial bang for their buck with this program. And in your testimony, you talked about the thousands of Americans who were locked out of the accessible private insurance coverage before the Affordable Care Act, and you talked about the difference in what they would have had to pay in the regular high-risk pools versus what they pay for us. You talked about Mr. Garner, who was reported on in the New York Times, and how his insurance might have cost, you know, been prohibitive, but this program helped him. Do you have any other examples that you'd like to share with us?
Well, I don't have a specific example. I can only tell you that for people that have conditions like diabetes, heart conditions, heart disease, cancer, of course, that if coverage is available, and in some cases it simply isn't, other than a state-run high-risk pool, they're gonna pay a lot either way, and that creates significant affordability issues for individuals. So they're really in a no-win situation, and that's why this program is so important.
Thank you. Mr. Chairman, I yield back the balance of my time. Thank you for your answers.
The gentlelady yields back the balance of his time. Mr. Gardner is recognized from Colorado. 5 minutes.
Thank you, Mr. Chairman. Thank you, Mr. Larson, for your time here today. And just wanted to talk a little bit more about this issue of the early retiree insurance program. Your previously stated your position, and I just want to double check on that. Is it really your position that these corporations that you listed on your website, who had billions of dollars in profits, needed to get taxpayer money in order to fund their early retiree program?
My position is we want to make sure that companies that are currently providing early retiree benefits continue to do so, and this program helps ensure that they do that.
And so this is all programs in the United States, or just a few that you've listed on your website?
Well, this program helps the sponsors who come in for a reimbursement request to be able to continue their retiree program. So this helps cover the costs that they would otherwise incur.
So companies like Shell Oil Company that had a contractual obligation that they would otherwise incur, we're giving $4.4 million to?
Well, ultimately, the money is for the benefit of the retirees.
But it's money that taxpayers have that we're just giving to Shell Oil Company?
Well, we're helping make sure that Shell Oil and other companies continue their retiree program.
So other companies like General Electric, the Boeing Company, AT&T, Verizon, DuPont, Mars, those kinds of companies?
Well, and there are many other smaller companies. I think if you look through the list, there's a large number of companies that got, $1 million or less in reimbursement. So it's not all just big companies. And in fact, the biggest recipients are state and local government for this program.
Do you think they should have had to pay for their own?
I think that we want to make sure that retirees of the ages between 50 to 65 before Medicare have an option for coverage, because if they don't, they're in a very hard place in the marketplace.
So do you think it's the government's responsibility then to pick up the obligations of a privately agreed to contract?
Well, I don't know in which cases there are specific obligations or not, but we in any case want to make sure that there are funds available to make sure that these programs are continued.
Was that part of the discussion, though, and who got this, the bailout? Was which companies had an obligation or contract to do that, or did it just, the money came because they asked?
No, the way the program is established under the ACA is they apply as a sponsor, we review it, and once approved as a sponsor, then they submit the claims for reimbursement.
So you would know which of these companies were contractually obligated to make these payments anyway?
That's not part of the provisions of the ACA.
So you just gave this money without knowing whether or not they may be under contractual obligation. So the United Auto Workers, who got $207 million, weren't contractually obligated to pay for these health care costs?
Well, it's actually, and I think we've corrected that, it's the United Auto Workers Trust Fund. So the United Auto Workers didn't get the money. The trust fund that administers the early retiree benefits gets it. But whether or not they're contractually obligated to do it, this provides benefits to the early retirees.
So what standards were there that many of these Fortune 500 companies then had in order to get this free money?
Well, they have to demonstrate that they have claims experience between the threshold that's set up in the Affordable Care Act. So the ACA requires or provides that under this program, 80% of the cost for retirees between the $15,000 and $90,000 limit is reimbursed under the reimbursement program.
So pretty much anybody who applied was accepted to this program?
Well, I wouldn't say that, although I think that most of the companies that applied were approved as sponsors. There were some that weren't.
So if you issued you issued the regulations for this program, is that correct?
SOCIO issued the regulations, yeah.
Was there a need for more restrictive regulations, or?
Well, we issued the regulations that were called for under the language in the Affordable Care Act for the program.
Do you think they needed to be more restrictive?
I think the program is working well as it is. If Congress wanted to revisit the program, we'd be happy to work with people to make sure that we continue to be able to provide ongoing retiree benefits.
But, I mean, do you think it's right though that the taxpayers gave free taxpayer money to GE that is making billions of dollars, not paying any taxes, needed another $36 million of federal government money?
Well, I think it's hard to look at this program in isolation. I mean, we've got a number of bridge programs in place. We've got the PSIP program, we've got ERRP, all of which help get us to 2014, that avoid uncompensated care, avoid the burden that some particularly sick or vulnerable populations may experience if they don't have coverage.
Now, you said get us to 2014, but you're ending the program soon, correct?
Well, not soon. The money could run out in fiscal year 2012.
So the money's going to run out soon, and then what happens?
Well, then that's the end of the program unless Congress appropriates additional money.
Is it your opinion that Congress ought to appropriate? Will you be asking for more money?
We'd be happy to work with Congress, should they choose to look at other options to extend the program.
But you think continuing these bailouts is the proper role for the federal government?
Well, again, I think we disagree on the bailout terminology, but we think this is a good program.
Gentleman's time has expired. Before I go to the next speaker, I just ask unanimous consent to put into the record the ERPP memos that are issued by CISIO on March 2nd and March 31st, our staff memo of March 23rd, the Chief Actuary report of April 22nd, HHS response to the Committee on High-Risk Pools, February 28th, and the New York Times article on GE. No objection. It's agreed upon. And at this point, we recognize the gentlelady, Ms. Myrick, for 5 minutes.
Thank you. Excuse me. I really have a lot of the similar questions to what Mr. Gardner asked because of the same type of concerns that this $5 billion in money in the early retirement retiree reinsurance program is gone to corporations and unions. And again, I just have a hard time understanding when companies like one of them that made $20 billion in profit can't afford to do their own programs. And if the health care plan wasn't there, that they can dump their employees on anyway if they chose to do that. I mean, all of this just doesn't make any sense to me. And so I guess how do you justify, you said, and I heard you when you answered Mr. Gardner, that you say, well, it's because you want them to continue to have coverage. But it really, it just doesn't make any sense that we're using taxpayer money to fund their early retirement programs when they're making huge profits. And he mentioned the United Auto Workers Trust Fund, which you clarified. But they reported assets last year of over $1 billion and only $4.5 million in liabilities. So why was it necessary to give it to them?
Well, and as we've, I think, discussed earlier, that history shows that the number of large employers, even that were or are offering retiree benefits, health insurance coverage for their early retirees, has dropped dramatically from, I think, 2/3 to about 1/3. So I don't know whether those companies were profitable or not. I'm sure many of them were, and yet many of them continued to drop their retiree coverage. So this provision of the ACA is a way to ensure, as best we can, that that rate of dropping of retiree coverage does not continue.
Well, again, I just go back to the fact that I'm willing to bet the people in my district who our unemployment's 11.1, and they're having a heck of a time making it today, and they're giving their tax money to the federal government, and now that tax money's gone to these corporations to pay for their retirement programs. I don't think they think very highly of that, and it really aggravates me, too, very frankly.
Again, as I've said earlier, the benefit of this is for the retirees themselves and to ensure that they have continued coverage. The money can only be used to reduce the costs for the retirees, like coinsurance, or the costs of the company as it relates to the provision of the retiree benefits.
But there really weren't any real specific guidelines they had to follow to apply for this program? I mean, pretty much most of them, you said a few of them didn't get
well,
it.
They had to send in a list of how many people they covered, who the retirees were, so there's documentation certainly that goes along with becoming an approved sponsor in the program.
To me, again, this program proves that, the notion that health care reform, the law is going to lower the cost is just preposterous. You take $5 billion to allocate for what I think is a dubious program, because the administration is just anxious to give it away. And it already looks like it won't last until, you said 2012. I thought it was 2014. There are commitments made to like 5,000 entities already. 1.8 billion has been paid out. So how is that $5 billion going to be nearly enough for the corporations and the unions that you're giving it to?
Well, at the rate now, it's unlikely that it will last till 2014, certainly. I think we did announce yesterday that we would stop taking new applications for approved sponsors after, I think, at the end of April. So we are going to stop the pipeline, if you will, of eligible companies and state and local governments that can apply.
I know you've already talked, I'm sorry I was unable to be here earlier, I was in another hearing, about the high-risk pools, but I did have a question particularly relating to North Carolina because they've had a functional high-risk insurance pool in operation prior to the passage of the health reform law. And when the new law went into effect, they were required to set up a new pool alongside the state pool they already have, which was functioning. It's very confusing to consumers, but it just seems kind of odd that the federal program would essentially require the operation of these two separate pools. And why couldn't North Carolina have just had the option to take the federal money and expand the pool that was already working, because it has been working for them?
Well, there's certainly no requirement that they set up a separate pool. For the states that decline to do so, HHS, through our contractors, operates pools in 23 states and the District of Columbia. And the statutory provisions relating to the federal PSIP are different than the terms that apply under state law for the state high-risk pools.
Right.
So, for example, there's no waiting period for coverage for a high-cost condition in the federal program. So it really serves as a complement to the existing state programs. And states have been able to leverage off their state pools in terms of advertising and knowledge about this pool as another alternative for individuals to be able to go into if they've been denied coverage for pre-existing conditions.
I'm a little confused. What I was told that in North Carolina, a person must go without insurance for 6 months before he's eligible for federal coverage.
Correct.
But the state pool doesn't have this requirement.
Right. So it is a little confusing because they sound the same, but they're different requirements. For the federal pool, you are not eligible if you have had insurance for the preceding 6 months. Typically, in a state pool, there isn't a requirement like that, but there are often requirements that when you come into the pool, that you may have coverage for your pre-existing condition excluded, or there's a, quote, waiting period for coverage for your condition. So they each have different provisions relating to waiting periods and insurance coverage.
Yeah, I know.
Mr. Chairman,
Thank the gentlelady's time has expired.
I move to strike the last word.
The gentlelady is recognized.
Thank you. I think that my colleague from North Carolina is onto something, and maybe we can work to figure this out. Here's the problem: is she's absolutely correct, and Mr. Chairman, you're correct, and everybody's correct. These large companies and unions that have very high assets and profits are taking advantage of this program. The problem is there's no legal requirement that these companies offer insurance to their early retirees. And so what's happening is, as the economy went down, people took early retirement, then the companies discontinued their health insurance. And we can't make them offer health insurance. It's a contractual obligation that they have with their employees. So if they don't have that, then they can't make we can't make them give their early retirees health insurance. So then they won't have health insurance. But I think maybe something we could work on, especially since this program is running out of money, is maybe we could find some other way to incentivize employers giving health insurance to their early retirees that doesn't consist of just simply subsidizing it. I mean, short of that, what we would have to do is we would have to pass some kind of legal requirement that they offer insurance to early retirees, and I don't think that's going to be acceptable to Republicans or most Democrats. I'm just brainstorming, because I think we could probably modify the program so that we wouldn't just be paying out the money, but maybe some kind of incentive.
Well,
I'd love to work on
I'm very glad that the gentlelady, the ranking member, is also outraged, as we are, that taxpayers' money are being spent on large corporations who are very profitable. You
don't need to characterize what I just said.
Well, certainly I can characterize what you just said. So I'm glad you agree with us that this is obscene. Let's see. The next, you mentioned before that companies were rejected from the ERRP program. Will you be kind enough to submit this list for us for the record?
For applications that weren't accepted?
Yeah.
I will.
Okay. And we're going to Scalise, the gentleman from Louisiana. Is recognized for 5 minutes.
Thank the chairman for yielding, and thank the gentleman, Mr. Larson, for coming before us to testify. One of the things as I look through this list, back during the beginning of this whole debate, I think everybody recognized there were problems with the cost of health care and problems that needed to be fixed, like pre-existing conditions being discriminated against, that those of us that supported alternative legislation addressed directly without these taxes and mandates that are creating all of these problems. In fact, our bill was scored to lower the cost of health care by 10%. What we're seeing now, and I think one of the reasons you're seeing so many of these companies on this list come to the federal government saying, give me taxpayer money so that I can fund early retiree programs, is because what these companies are seeing is since Obamacare has passed, the cost of health care has dramatically increased. It's something we've seen. There's a consolidation in the industry. We've already seen a number of other problems from it. But you yourself just testified earlier that some of these companies that got millions of dollars, tens of millions of dollars in some cases, could have just been giving early retirement to their employees that otherwise would have been still working for the company, but because of the high cost of health care and the things that they had to do to contract, they pushed some people into early retirement. And I'll ask you to clarify if I'm incorrect, but you did say there's nothing you saw in the reports that you got, these requests for these companies. Could they have done that? Could the companies have said, because of the high cost of health care and these new burdens and mandates and taxes because of Obamacare, we're now going to have to squeeze some of our employees out into early retirement? And if they did that and they packaged those employees and put them into early retirement and asked for money from you for this program, they could have gotten the money. Is that correct?
What I said was that we didn't evaluate as part of the process.
So they could have done that. Is that correct? Or did you prohibit them from doing that?
We didn't evaluate the process by which they have an early retiree program.
If they did that, what I just said, if they consolidated, moved some employees that would today be working, but now were pushed into early retirement because a company couldn't afford the higher cost of health care because of Obamacare, and then they pushed them and sought federal taxpayer money for the EERP program, they could have gotten it. And some probably did, right?
Well, I don't know. I mean, if it costs money to provide them health insurance as an employee, it's going to cost money to provide them early retiree.
So you didn't even ask that question. When they asked for the money, if they did what I just categorized, they could have gotten the money, and you'd have no way of knowing that. Is that correct?
If I'm understanding what you're saying, we didn't evaluate the process by which they ended up with an...
That's exactly right. So basically, if a company said, because of the higher cost of health care due to Obamacare, we've got to consolidate.
I think we part company.
Well, but I mean, the marketplace has shown that health care has gone up, and in fact, you're seeing a consolidation of health insurance providers.
It's been going up.
We're saying it happens specifically, but the consolidation that's occurring right now, they'll tell you, is because of Obamacare. And talk to business owners. I mean, maybe you don't ask those questions when you review these forms. I talk to businesses every day. Small businesses will tell you, medium-sized and even large companies will tell you that the mandates and new taxes from Obamacare is one of the things that's pushing them to have to cut costs in other ways, including pushing people into early retirement. And so when I look at this list, first of all, the largest, unless you've got somebody higher, the largest recipient was $206 million to the United Auto Workers Trust Fund. Was there anybody that got more than that?
Well, collectively, state and local government was the largest recipient.
Oh, right. I mean, you bailed out the state of California to the tune of $57 million. You bailed out the state of New York for $47 million. You talked earlier in your testimony that you categorize this as a successful program. I mean, the program's going bankrupt because you're giving away so much money to bail out states and unions. I mean, did you really think it was going to be hard to give that money away? I mean, how is that a successful program when companies who were making big profits and and unions and states took tens and hundreds of millions of dollars from you? How's that successful?
The program is not going bankrupt. Congress allocated $5 billion.
You said in the press yesterday that you've allocated $1.8 billion already, and that you're going to have to close the enrollment period earlier than expected because you're going to run out of money.
Sure, but that's not a bankrupt program.
Well, it's a program that's running out of money. Let me ask you this. Do you know how much money we spend every day that's borrowed money?
I don't know the answer to your question.
Okay, 42 cents of every, from the numbers I've seen, 42 cents of every dollar that the federal government spends is borrowed money. And when you look at this program, I don't know if you can appreciate how offended some of us are that you're giving away $57 million to bail out a state like California. You're giving away $206 million to bail out the United Auto Workers Trust Fund. I understand you gave $5 million of taxpayer money to BP. Is that correct?
You can't lose sight of the million.
Did you give $5 million to BP?
If it's on the list, then we did.
I mean, my God. You know, you wonder why people are offended by this program when they're seeing all of this money going out the window, money that we don't have, 42 cents of every dollar, and correct me if I'm wrong on that number, but this shows that the program is broken, and the law itself has created more problems. We've already seen companies are dumping prescription drug programs because of the taxes in Obamacare, where you increase taxes on them, so people are dumping their prescription drug programs because of the law. And
this
so again,
program
we've got a program here.
Them continue that for retirees. That's exactly
right. And so now we're seeing that companies are pushing more people into early retirement because of the higher costs due to Obamacare. And now you're giving them taxpayer money, in 42 cents of which of every dollar we don't have. And you know, and maybe you don't understand why that offends some of us, but it's very offensive.
Gentleman's time has expired. The gentleman from Virginia, Mr. Griffith, is recognized for 5 minutes.
I might be the last. I might not. Who knows? But hopefully it is. Let me ask you a question. You were talking earlier, and you said that you can't look at this in an isolated situation. That there are lots of things going on out there, and that was in response to a question related to the money given to GE. Has GE gotten more money from you all under different programs?
No. I just meant that we have a number of bridge programs that get us from kind of the broken market that pre-existed healthcare to 2014. This is one of them. PSIP is one of them, until we have full reform implemented in 2014.
All right. Now, here's my problem with this program, as I've been listening to the testimony here today. It sounds like that as long as you provided employees with retirees with a health insurance plan, you were eligible to get money. And I'm just wondering, you all set up the regulations for this. Why wasn't there a requirement that there at least be some indication that the company, following what you have said was the reason for it, that the company was not going to provide it? Because it sounds like to me, from what I've heard, that what you all have said is if they provide the benefits, they get the money. But we did it because we were afraid they were going to discontinue. So we may very well, as taxpayers, have given an awful lot of money to big companies like GE and AT&T and all the other ones that have been mentioned here today who had no intentions. But like any good business, if the federal government is handing out candy for free, they're going to take it. And they have the people who are able to go out there and look for it, where we may have actually shortchanged, if this is what you were trying to do, some small businesses or micro businesses even that might have been wanting to do this but had no clue there was a program like this. And I'm just wondering why you didn't have regulations that it would at the very minimum have required that the companies state that they were going to discontinue their program if they didn't receive assistance within 90 days.
Yeah, well, we tracked the statutory provisions when we put the regulations together, but I'm not sure we would have been able to get those representations in advance of the program.
So we were in such a big hurry to get Obamacare on the books, to get Obamacare into place, that we didn't bother to take a look at what was going to happen to the taxpayers. Is that what I just heard you tell me? We had to get the program started. We couldn't take time to make sure that we weren't just giving money to giant corporations who had no intentions of discontinuing their health insurance to retirees. That's the way I heard what your answer said.
Well, we had statutory deadlines under which we wanted to get the program operational. But that's not why we didn't do as you suggested. We implemented the program as it was set out in the provisions of the Affordable Care Act.
How much notice was there? You said that most of the beneficiaries were state and local governments, and I'm just wondering, did the Virginia VRS get any of this money?
I'd have to go back and look at the list. I'm not sure.
Say yes. I mean, I'm just wondering because, based on your criteria, they would have.
I think all
qualified. That's all right. They'll get me an answer later. Other than just looking at the bill itself, and I'm glad you found yourself constrained by the bill, because we've had some other agencies in here that seem to think they can make up the rules as they go. But in that regard, you don't think you had the ability to create a regulation or a rule that would say that you had to be getting ready to discontinue your benefits in order to hand out these checks?
I will confirm back to you, but I don't believe, and I wasn't here when we drafted those regulations, but I don't believe that we saw the statute as creating the type of program that you just described.
Okay.
But we'll confirm that with you.
And you just came in what, December, January?
Well, as the head of the SOCIO, I was running Oversight, but not ERRP.
Okay.
Yeah.
So these regulations would have been the previous initial name, which, what was that? SOCIO, before they changed the name?
Yeah, OSIO.
OSIO. And so that would have been, the regulations would have been created by that administrator at that time?
Well, it was the same individual. I'm just saying I wasn't personally involved in the regs at that point, but I'm just saying I believe that we did not conclude that we could have created a kind of a needs-based program as you just described.
That would have been the same fellow who got hired 5 weeks before the bill passed, but was hired under the authority of the bill that had not yet passed, would it not? You were here for that testimony earlier. I was too. So I am correct, am I not?
What you're referring to, I'm not sure I agree with the characterization.
I'm just repeating what he said. All right. Mr. Chairman, I yield back my time.
Thank you. And if my colleagues, we're going to go one more round here. So, Mr. Larson, I appreciate your patience staying through we voted. And, following up with Mr. Griffith just said, is there any way you can confirm that all these companies that my colleagues have talked about, that when they said that they are going to drop their coverage, do you have the ability to go back and certify what they say is correct? And
maybe there's, under the current program, they are not required to certify.
No, my question is,
right.
GE comes to you and said that we cannot pay for all these employees that are doing an early retirement.
Right.
And we need $36 million. And you say, okay, you look at it and you give them the money, but you certified that all these people would lose their, yes.
Mr. Chairman, if you would yield for just a second.
Sure.
My concern was, and I think his testimony was that they didn't even ask that question.
Right. So I'm following up.
Oh, okay.
Not only did they not ask the question is, do you have anything in statute that says you should have certified this and you didn't? So my question is there something in statute that says you have to certify that they will lose their coverage?
No.
And did you do that? So
no,
there's nothing in statute that says that you have to certify that they will indeed lose their coverage.
The CEO has an attestation that the information that they're providing in connection with the application.
So the CEO does this and that.
No, but just to be clear, the CEO doesn't attest, nor does the statute provide for a requirement.
Well, how do you prevent somebody from telling you that these employees are going to lose it?
No, all they have to do is tell us that they have an early retiree program.
Right.
And provide the documentation for the claims that satisfy the statutory threshold. They, of course, must continue the program.
Do you have an outside source or anybody that confirms in your office that what they provide as these papers are accurate?
Oh, yeah. We audit and validate the claims data that they provide. But again, they're not representing to us, nor does the statute require them to represent that if they don't get the money, they won't continue their program.
I mean, is it possible that a lot of companies will come in and say they need the money? After they see this list, they'll come in and say, I need the money. They'll submit the papers to you, and they really have a profit that they could cover it themselves. How do you know that they can't cover it themselves is my question.
Well, the premise of the program is that the best way to ensure that these programs continue is to provide the assistance that's set out in the program. Because, again, we know that many companies have continued to drop this coverage, probably many that were profitable.
Mr. Larson, you told the press yesterday that you're closing enrollment for this program. And you just said it either to Mr. Griffith or Mr. Scalise.
Right.
You reported that you've already spent $1.8 billion. Is that correct?
That's correct.
Okay. Is that all that is accounted for today, or are there additional claims that have not yet been included in that report?
You mean of the $1.8 billion?
No. Okay, you've already spent that.
Right.
But are there other claims out there that have not been included in this report that you're going to approve and are going to make the list longer? Yes or no?
Yes.
Okay.
But may I?
Has all the $5 billion of the program already been obligated?
No.
And how much is left?
Well, that's what I'm trying to say. So
just approximately.
I'm going to tell you.
Okay.
We've gotten $1.8 billion in paid claims.
Right.
At any given point, we can tell you what's been paid, and then there are claims being processed that we know about but haven't yet been paid. They have to be verified. And the decision that we made to close, it's not to enrollees, but it's to plan sponsors. So all of the companies that have been approved as plan sponsors, and sponsors just means you're eligible to.
Are you going to have enough money?
Program. What's that?
Are you going to use up all the $5 billion?
Oh, I think we will use up the $5 billion.
Okay.
But I think that'll happen in.
How many have not been verified and are waiting?
It's a small number. We had
100, 50, 10.
It could be
100.
It's
it could
not
be
many.
100.
I think it's
could be 1,000.
I don't think it's 1,000. No.
How much money is left? Are waiting to be verified?
Now, I just want to be clear. When you say waiting to be verified, do you mean claims or applicants? Applicants to me is a company.
Claims.
Oh, it's not a large amount.
Okay.
I mean, we can get that to you, but it's not like there's another $1 billion in claims that are out there. We've reported what claims out the door. There's always going to be a small amount of claims that are in progress.
You know, you're really in a position of being Santa Claus, you know. And here we are at Easter. So I think a lot of us just find this unbelievable that you can just hand out this kind of money based upon a criteria that's not clear and based upon not certifying except through your staff their word of mouth that they cannot pay these early retirees. And then I think you said that you're going to close this down, but refresh my memory, wasn't this program supposed to go to 2014 originally? Isn't that true?
Yeah, ideally.
Okay. So the fact is that you've ran out of money, so that's why you're going to force to close it. So, I mean, isn't this a bad reflection on this program that the fact is that you're running out of money? It's supposed to last
I think
two-thirds.
it's a reflection of the success of the program because there are a lot of companies that have.
Can I tell you an honest secret? Everybody takes free money. If you can get free money, I think you and your friends and neighbors would take the money if it's free. So you're going to always run out of money if it's free. With that, my time has expired. I'd like the ranking member.
Thank you, Mr. Chairman. So the title of this hearing today is the PPACA's High-Risk Pool Regime, High Cost, Low Participation. So really the entirety of the questions on the other side have been about the early retiree reinsurance program, so I guess we can stipulate that the PPACA's high-risk pool regime is in pretty good shape. So the first thing I want to do, Mr. Larson, is thank you for answering all of these questions that I don't know how prepared you were to come and answer them, but I certainly had not been briefed by the majority staff that they would be focusing this hearing on this topic. So I think you've done an admirable job trying to answer these questions about this other program. I want to try to clarify some things for some of the members who perhaps don't understand the basic facts of the early retiree reinsurance program, and maybe even for my own edification. What is the purpose of the program? Briefly, Mr. Larson.
The purpose is to ensure the continued availability of health benefits for early retirees that are provided by the range of applicants that we see.
Okay, and that's people between 50 and 65 who have retired from their jobs.
That's right.
Many of them are employed by large corporations or, correct?
All right, but many are not.
Many are not. And about how many individuals have enrolled in this early retiree program?
Well, to clarify, we don't enroll individuals.
Right, you enroll the companies, but how many?
There are about 5,000 plus, maybe 5,900 sponsors.
And how many people, how many employees are involved in those?
Well, I think at least 4 million early retirees are in programs that have benefited from ERRP.
So by
millions of people.
The way the law was set up as this bridge program till 2014 is that the companies and the union trust funds and others could sign up for the program, and then they would use that to insure the employees. So there's like 4 million people who might not have insurance right now who are getting insurance, right?
Yes.
And if those 4 million people, as far as you know, the companies are not obligated to offer insurance to those early retirees. You don't know one way or the other, right?
We don't know, but I'll also believe that even profitable companies are known to stop providing retiree benefits, health insurance benefits to their retirees.
Right. So, you know, this program is modeled on the Part D Medicare drug benefit that the Republicans passed last time they were in the majority, which gave $70 billion to companies to provide drug benefits to seniors. Is it that correct?
There can be parallels there, yes.
Okay. Now, do you know that large firms who provide workers with retiree health coverage dropped from 66% in 1988 to 29% in 2009?
Yeah, it's a big problem.
It's a big problem because it leaves people between 50 and 65 who are not eligible for Medicare yet, but many of whom have pre-existing conditions or health problems going out into the individual insurance market and trying to buy policies, right?
That's correct.
So if we hadn't have done some kind of a bridge like this, then that would have potentially left millions of Americans out there it would have added to the number of uninsured until 2014 when they can enroll in the exchanges and so on, right?
That's exactly right.
Now, look, I'm not sure that even though maybe this is modeled on the Part D program, which just gave $70 billion to companies, maybe the way we've got it structured is not perfect. Maybe as we go forward, since it's been so popular, we should require employers to certify somehow that they're not going to be able to offer these benefits. But the bottom line is the benefits ultimately inure to the employees, not to the employers, right?
Correct.
And that's 4 million people that might not otherwise have health insurance, correct?
That's right.
Thank you. Thank you, Mr. Chairman. I yield back.
All right. Gentleman yields back. The gentleman from Virginia for the second round of questioning.
Thanks. Well, I thought it was going to be your last one, but we're going to do a couple more rounds apparently. I think that in response to my colleague, I think that the reason that you've gotten so many questions today is that the news didn't break until yesterday about the other program, and so a lot of folks were a little bit surprised that we were giving away the free money, so to speak, and that was the concern that you've heard a lot today. But I do think that there's some concerns that overlap with the program that initially this hearing was about, and what I'm hearing in this is that you've said that the program for the retirement money, you know, it'll go till the $5 billion is used up and then it's over with. For the high risk pools, however, it looks like you all are spending money on that to a point where it may actually that $5 billion may not be able to survive. And I look at
not able to survive, meaning run out of
the $5 billion before
for the PSIP program.
For the PSIP program, because you've got. I mean, I'm looking.
We're going to work within that, but we're off to a slower start than was projected. But we believe that we're going to continually increase the rate of enrollment.
Well, let's touch on that before I get back to the money issues.
Okay.
You're off to a slower rate than anticipated, and in fact, wasn't it anticipated that there would be about 375,000 people who would be involved in that program in 2010 alone, but there were only 12,000. So isn't, in fact, at least for 2010 and even into early 2011, isn't, in fact, the program's been a failure?
No, I wouldn't at all characterize it that way.
Well, okay. I disagree, but that's all right. That's what life's about. Now, that being said, let's go back to the money issue, because it appears, according to, and I'm looking at some notes here that say the Washington Post reported on December 27th that New Hampshire has only about 80 members, but they'd spent double the $650,000, and then HHS agreed to give New Hampshire more money and is basically taking it out of money that they anticipated that they would be spending in later years.
That's right.
California has indicated that they think they'll spend over the life of the program $1 billion. And Alaska, while it only anticipates having 132 enrollees, anticipates spending $7 million or $56,000 $56,000 plus per enrollee. Looking at those numbers is why it looks like to me that even with the failed numbers of coming into the high risk pools, that you're not possibly going to be able to do it on $5 billion. Isn't that a fair assessment?
I understand your point, but I don't agree, and here's why.
You don't agree, but it is a fair assessment. Reasonable people can disagree, but you would agree it's a fair assessment coming from my philosophical position. Would you not?
I would not.
All right. Well, go ahead with your position.
So it's very early in the program, and there are certainly some states that are running ahead of their projections. So every state had to provide within their allocation projections regarding the number of members and the costs. And that was part of the contract. There are certainly some states that are running ahead of projections, meaning like New Hampshire, the people that they have are much more costly than they projected, so they're running through their money faster. There's many other states that are not running ahead of projections. So we will continue to monitor exactly and do with monthly reports that we get from the states each month where they are in terms of their costs and their enrollment, and we will work within the $5 billion appropriation through the cycle that we have.
So then doesn't that mean that if you're one of the states that's looking at this thing, that you're much better to spend your money now and get your upfront money, because at some point you're going to have to marshal the funds and not give as much to the states that might come in late?
Well,
Isn't that what you just
states
said?
can't run ahead and spend the money. It's a function of at what rate people come in to the program.
Okay.
So,
If New Hampshire is spending more money than they were allocated in the first year, and you allow them to have more money coming in, and if a few other states start doing that, isn't it possible that if enrollees in a state that's not doing that right now come in late into the process, there may not be money there to take care of them? Isn't that accurate?
not to be argumentative, I suppose it's theoretically possible.
There you go.
We don't envision that happening, though.
Well, yeah, if you envisioned that happening, you'd put more money in the program.
Well,
I
we're
understand
limited.
that,
We're
but-
limited to the $5 billion.
But it is not only theoretical, but based on the early data, it's possible.
I don't think it's likely.
All right. I yield back my time.
Gentleman yields back. I'm going to ask to ask some more questions and certainly give the ranking member if she wants additional questions. She brought up the fact that the hearing was really scheduled dealing with the high-risk pools, and I think it's important also to recognize that we have been asking for all this information on the early retirement reinsurance program. We just got it, and so the breaking news on it, so we thought since you're here, you could accommodate both of them. But I think her point is well taken, that we are also here because of the high-risk pool. So I have a few questions for you before you go. How many people are enrolled in the high-risk pools today?
I believe that the number that we posted in March as of February 1st was 12,000 plus, and since that time there have been additional enrollments. Enrollment continues to grow at a pretty fast clip. So,
how many people are enrolled solely in the plan that's run by the Health and Human Services?
I think it's over 3,000 of the 12,000.
Okay. Does HHS publicly disclose the number of individuals enrolled in each state's high-risk pool?
Yes.
Do you publish that?
Yeah.
Okay, and it's easy to get access to go to each state and find
I'll
out?
confirm, but I believe that we do.
So I could find in the state of Florida.
Yes, actually, I'm sorry. Of course we do. Yeah, we do. In the posting that we put up in November and the posting that we put up in March for February, it lists the state enrollments, and then it lists the number for the federal PSIP enrollment. So you can go back and you can see what's happening in each
And
state.
towards that end, will HHS please submit a detailed breakdown of the number of individuals currently enrolled in each state pool and the federal high-risk pool for the record?
We can, but I'm pretty sure that's what's posted on the website.
Okay.
If the chairman will yield to
I'd be glad to.
healthcare.gov, I've got the listing right here, and
All
I've
right.
asked unanimous consent to put it in the record.
Yeah.
By so ordered. Now, we've been talking on this side, obviously, and you've admitted it, that you're going to run out of funds dealing with the early retirement insurance program. Isn't that correct?
It's likely at the pace that we're going.
And in fact, you indicate you're going to shut down the program.
No, just to be clear, we will.
I mean, if you run out of money, you're going to shut down the
Well,
program.
just if I can clarify,
Yeah.
we announced that we would stop taking new applications for new sponsors.
Which is an indication you're slowing down or stopping
And then,
the program.
but for existing sponsors, we will continue to process claims until the $5 billion appropriation, until it runs out.
Okay, dealing with the high-risk pool program, you have about $5 billion in funding. Is that correct?
Correct.
Okay. To date, how much funding has been spent of this $5 billion?
I think that was the number that we were discussing earlier, which the 33 million and roughly 25 million minus the startup costs. So it's in the $60 million range total.
Is it safe to say that this program is going to run out of money before 2014?
I don't think so. I don't think so.
But you're not sure?
Well, I don't think we're going to run out of money.
We've asked you for a number of documents related to creating the waiver process, and we've had previous hearings. Your response has been very slow on this process. Will you commit to getting these documents and emails to us next week? Is that, Mr. Larson?
We are committed to continuing to produce the records that you've requested. We've continued to prioritize our production in response to requests from the committee. I know we've responded to many of them, but not all. I will do my best to get them to you as soon as we can. I'm not sure for those particular records I can commit under oath that I'll have them next week.
Do you know it's been over 2 months since we've requested
and we've had many, many requests from you and others that we're really trying to work on. We respect the committee's ability to get this information, and we will continue to push to get it to you.
We've also asked for Medicare fraud estimates, and is that in your bailiwick?
I will, but I'll take it back to my colleagues.
Okay, you can ask them. Okay, let me say thank you for your attendance here, and the ranking member, would you like to close? Any additional? Okay. We appreciate, again, your forbearance here as we went through our voting process, and again, it's very helpful for us to have you here and to answer your questions. And so with that, no further, the subcommittee is adjourned.
Thank you.